Welcome back to our Aligning to Business series, brought to you by Clinical Mobility. My name is Shawn Jackman, and I'm the founder and CEO. And when you think about wireless in healthcare, you should think about clinical mobility, because that's all we do. This is a continuation on our series, and we talked about the problem statement before. There's a series of things that come next. Those of us in IT has squishy edges. Sometimes you could include healthcare technology management or biomed, or there's different names, HTM professionals, or the current term, the modern term, clinical informatics. I really mean that with respect to those of us who have an IT aspect to our job, because we're focused around solving business problems. Again, it's always about the business, and the business is healthcare. Everything we do has to be calibrated against healthcare. And how are we helping improve care? How are we helping patients recover? You name it. Anything that comes to mind around improving care, IT, we play that support role, and we have to be always calibrating our mindset to focus around this. So let's talk about stakeholders. What are stakeholders? Stakeholders are any people that have an interest in or a concern in an area that you're addressing. For example, this one may be a little too big, but clinical communications. How do clinicians communicate with each other when they're doing their job? Who are they communicating with? Is it just within let's say a department? Within let's say a nursing unit, or within the emergency department? Maybe, but you have groups outside there that are part of the workflow. And we've probably all seen this, where a department manager lead says, I'm gonna buy this technology, and you think, well, sure, that's gonna be combined or confined just to that department. Usually not. And there's groups that they need to collaborate with. And so an example, reason why I picked that up is because your stakeholders aren't always whom you think they are. Of course, you're going to have the obvious ones that come off, but I need you to consider everybody involved that has a concern. Of course, that could be everybody, but filter it up. Let's think about the major stakeholders, if you will. If you're architecting a solution, because you've been asked to solve a problem, so you're architecting a solution, coming up with a plan. Oftentimes in IT, where do we sit? Well, you probably sit in a place like I'm sitting in. It's an office. It's not a hospital, by the way. It's not a hospital, not a hospital. Like, we're sitting in cubicles. We're sitting in offices all day long. We're not afforded the same perspective. So just appreciate that and understand that in order for you to be able to help solve the problem, you have to go talk to the stakeholders. You're going to learn one thing more importantly than anything else is the size and dimension of the problem that you're trying to solve. When you talk to a departmental manager or a charge nurse or the CMIO to a hospitalist, physician, it's incredible what you learn, and you get to understand their problem. They're not technologists. That's not their job. That's your job. So you're listening, what you have available to you in terms of the technology. Or you may not have it all, but that, that's your job, is to bring that to bear. But the more that you understand the intricacies of their problems, the more aligned to, the better aligned the solution is going to be to solve the problem. Most of the time, this is skipped. And it's like, well, we need to deploy a solution. Well, let's go buy something. Wait, well, there's 5 different solutions on the market. Which one is better for our problems or our use cases and for our stakeholders and what really matters? And maybe one product starts to shine a little bit differently, rather than maybe what one strong person had an opinion for. And oftentimes, these people with strong opinions, they're just trying to get it done. They're just trying to solve the problem. And if you can come back and be a partner to say, hey, I understood the problems, and here are the stakeholders that are going to be involved in this. Here's what we learned. I'd love to share this with you. So you present this back. Everybody, well, there's always exceptions, but most people are very, very reasonable. And when you share that back, it makes you a strong partner in helping. So put yourself in their shoes. You just spent time to understand their problem. You took it to heart. You studied it. You came back to them and say, "Hey, look at what we've learned, and look what our team has come up with." Think about what that does to your audience, and what does that do politically to help align, for you to become in alignment with them and the partnership and the things positively that can come out of that. Oftentimes this is missed. So always think stakeholders, who and what groups need to be included in this. It improves collaboration, alignment across the organization. You actually get velocity in your you might slow down just a little bit in the beginning of this to then pick up momentum and have higher velocity as you get through the project. But more importantly, you're going to understand what problem you're going to solve, and you also gain the alignment from all the stakeholders along the way. That's it for today. It's all about stakeholders in our series around aligning to the business, brought to you by Clinical Mobility. Thank you for tuning in.